Dr. Michael Warner. He's the Medical Director of Critical Care at Michael Garron Hospital, and he joins us from Toronto. First off, I really appreciate your time. I know how busy you and all the frontline workers are, and we want to thank you for that. I want to start by getting your reaction to the Prime Minister's announcement this morning that he supports ramping up production of medical supplies. What do you think of that?
So I think that's an important announcement by the Prime Minister. There are a number of things that we need in the hospital to care for patients. So we do need ventilators, we need general medical supplies, but most importantly, we need personal protective equipment. That's the equipment that doctors, nurses, respiratory therapists, and other workers wear when they're treating patients with COVID-19, and in particular the N95 mask, which is what I wear when I put a breathing tube in someone's lungs. Without that equipment, we can't provide care to patients, so it's encouraging to hear that production will be ramped up. Hopefully we can get distribution done quickly.
So are you saying right now there's a lack of this equipment?
I can say that there's a foreseeable lack of this equipment. What I mean by that is at current use rates, based on what we're expecting to happen, we will definitively run out of personal protective equipment.
Do you know when that could potentially happen?
I think it varies by hospital because there isn't an equal distribution of personal protective equipment among hospitals, but each hospital has an inventory. It also depends on how many patients they get with COVID-19, but I can say that we will definitely run out of personal protective equipment based on current inventory levels.
We heard earlier from Saskatchewan Premier Scott Moe, and what he's saying, he's putting in mandatory rules now, saying bars have to close, casinos have to close, restaurants have to close, no gatherings larger than a certain number of people, and it's mandatory that there can be fines if these rules are not abided by. Do you think this needs to happen right across the country?
This needs to happen coast to coast to coast immediately. To me, that's what true leadership is, anticipating what's going to happen and making difficult decisions to protect Canadians. COVID-19 does not stop at borders between provinces, which is why this needs to be done nationally. We will get there eventually. There will be a national lockdown. I foresee that. I think there's going to be a lockdown in North America, to be honest. And if we do it sooner, the long-term pain will be less. Every day that passes where we don't do this, where people continue to not abide by social distancing because the guidelines are completely unclear among jurisdictions, is more opportunity for COVID-19 to spread among people. So I'm encouraged by what's happened in Saskatchewan, and I hope that other provinces and the federal government will fall in check.
Do you think the Prime Minister needs to make this decision now or days ago?
Yes. I think the Prime Minister has a lot of things to weigh, including the economic and social implications of decisions that he makes. If I focused exclusively on healthcare, which is my area, then absolutely, this decision was best to be made earlier. But there are a lot of things to consider. But social distancing, mandatory social distancing, clear guidelines on what that means, no opportunities for people to gather in groups of, say, less than 50, because that doesn't make sense to me. That's what we needed a while ago to reduce the spread of COVID-19. I don't think it's too late to institute those rules, but time is running out.
What happens if that doesn't occur?
So what we want to avoid is a situation like Italy or New York City or San Francisco or Seattle, where we're seeing exponential spread of COVID-19. It's a concept similar to compound interest, where patients infect more patients. If that happens, then we'll have a deluge of patients coming to hospitals in Canada all at the same time. And there's no system on earth that can handle that. And what we've seen in Italy is that with all those patients coming at once, not only are patients with COVID-19 not getting treatment, but patients who come in with other illnesses, overdoses, trauma, people requiring emergency procedures, we may not get them either. So the collateral damage of not flattening the curve is actually horrific when you think about it.
What do you see this looking like in a month, maybe 2 months from now?
Well, we're planning for all scenarios. In healthcare, we definitely plan for the worst case scenario. We hope for the best, but we plan for the worst. And that's what I'd like to see from the government. I think we need to overreact if that's what people think we're doing. We need to plan for the worst in every way. We need to make sure that we have enough supplies, enough ventilators, enough beds, enough nurses, enough doctors. And we need to make difficult economic and social decisions today that in retrospect may seem completely obvious that they should have been made earlier. So I am concerned. I am concerned.
What would be the worst case scenario?
I think the worst case scenario, for me personally as a physician, is to be in a position where I have a patient in front of me who I can't help, who I'd normally be able to help or save today. I think that's an experience that Canadians and Canadian physicians and nurses and other healthcare practitioners have never had to face. I'm concerned for my own family. I'm concerned for my friends. COVID-19 will touch everybody. There will come a point in this outbreak where everyone will know somebody who has COVID-19. And, I hope that people are listening and watching and listening to me when I say that social distancing is the most important thing you can do today to reduce the risk of you and anyone you care about, and even people you don't even know, from getting COVID-19. It's the only tool that you have, and it has to be taken seriously. And I'm calling on the government to make it clear to Canadians what social distancing means from my perspective. That means the safest number to congregate in is 1, not 50, not 10, not 250. That's what science tells me. I'm going to bet on science as opposed to hope and luck.
And you believe that the federal government needs to make this mandatory now?
Absolutely.
That was Dr. Michael Warner, the medical director of critical care at Michael Garron Hospital in Toronto. Thank you so much.
My pleasure.
The two largest provinces in Canada are taking their most extreme measures yet. As of midnight tonight, all non-essential businesses both in Ontario and in Quebec will shut down. They're ordered to do so. So we're looking this morning at what that means for both of the provinces. We have comprehensive coverage for you. Jay Turnbull is there in Montreal, and we're going to get to Jay in just a second. I want to introduce Megan Fitzpatrick, who is in Toronto for us in Queen's Park, which is the Ontario legislature. And Megan, if you will stand by, we're going to start with Jay and what is happening in Quebec. The Premier describes it thusly, Jay. Quebec is going to be on pause for at least the next 3 weeks. What is going to be happening there, and what information do we have so far about what will be closed and what will stay open?
Well, Heather, as you mentioned, all non-essential services will be closing as of midnight. So it's easier to tell you what will be open. So we know that grocery stores will remain open. Of course, that's about as essential as you can get. So grocery stores will remain open. We've had long lineups inside and outside grocery stores for the past several days now. It seems like months, but it's only been really not like a week or so since this thing has started. Gas stations will remain open. Drug stores, of course, people need their medication, so those will remain open. Yesterday there were long lineups as well outside of the government-controlled liquor stores, as well as the marijuana shops. Those, though, will remain open as well. The government considers those things essential as well, so those will remain open throughout the province. There was some concern, of course, that those were going to shut down, so there's a mad rush, people trying to stock up on liquor supplies, but that seems to be unnecessary. Now, restaurants will be closed. A lot of them have already been closed on their own. You know, walking down the street, it seems like 1 out of 2 has been shut down completely. But now we know that the delivery services will be open. If people need some food, they can order online. Public transit remains open, taxis, banks. So the reason we're asking why now, well, yesterday we had an extra 400 increase of 400 people who tested positive for COVID-19, and that's partly due to how the province is testing people. But here's what François Legault had to say yesterday.
In doing the lockdown today for 3 weeks, we put chances on our side that it goes better after. It won't come from anywhere else than somebody else if you get the virus. So if you're alone at home, there's no risk. So it's important to say that.
So right now, as we know, police are sort of out in full force. They're being, you know, gatherings larger than 2 people are sort of, they're not allowed right now. So police are getting a lot of calls, actually, inundated with calls from people saying, look, there's a party going on down my street. This store's open. Why is it open? We're getting lots of emails here at CBC from people saying, why is my workplace open? They're not taking the proper precautions. So police are being inundated with calls, and they are reacting. They are going to these sites and trying to shut these people down if they are gathering more than 2 people at once. And they do have the power now to hand out tickets to people who are not obeying the government rules.
We talked about that yesterday, Jay, how they have that state of emergency in place and giving the Montreal Police extraordinary powers that they haven't had since the ice storm in 1998 to do just that. It's interesting to hear that Montrealers and Quebecers are taking that seriously and wanting to make sure that those in their communities are as well. Thank you, Jay. Great to hear from you live this morning on what Quebec is doing. Jay Turnbull there in Montreal. We're going to hear from the Premier François Legault again today at 1 p.m. We understand that just announced, along with in Ontario, just across the border, Doug Ford as well, the Ontario Premier, set to make his latest address at 1 o'clock, and we will have coverage of both of those. Let's turn to the Ontario scene with Megan Fitzpatrick now. As I mentioned, she's at Queen's Park, and that is the Ontario legislature. Megan, we got from Quebec that list of essential services. We had a lot of reading to do, you and I, because there are long lists in both provinces, and they both came out late last night. So take us through what Ontario is shutting down as of midnight tonight.
It's a pretty similar list to Quebec, it sounds like, based on what I just heard Jay saying, Heather. So on the lengthy list of essential services and stores that will remain open, grocery stores, convenience stores, pet food stores, pharmacies as well. Other things, it's broken down by category, by the way, the list that is on the Ontario government's website: IT services, Office supplies, very important, as we know, for a lot of people across the country, but here in Ontario that are working from home these days. Gas stations will be open. The LCBO, the liquor stores in Ontario, will remain open, but Heather, I just learned that they have announced they will now close on Mondays completely, so they will only be open Tuesdays through Sundays, and they have already reduced their hours, only open now between 11 and 6. Hardware stores will remain open, taxis, like Jay said, as well in Quebec. Food remains only delivery or takeout only, so restaurants remain closed. No dine-in services available, just takeout and online. Hardware stores open as well. So that leaves some things off that list that will be closed, things like hair salons and nail salons, clothing stores. But keep in mind, a lot of big retail chains have already proactively decided to close their stores. Now, these conditions, again, these businesses that are not on this list being told to close by midnight tonight, and these orders are in place for the next 14 days in Ontario, but the Premier did leave the door open yesterday when he made this announcement that they might possibly extend these closures beyond the 14 days.
One specific question, Megan, because I'm hearing it from many people. What about construction sites? Did they make the list of essential, or are they going to be shut down?
Some of them are on the essential list, Heather. So there's a couple of bullet points under the construction heading on that list, and it includes projects related to the healthcare sector. So if any hospitals are under construction or expansions of hospitals, those will be allowed to go on. Same thing with projects related to transportation and transit. The list also says that demolition projects can continue, any kind of demolition project. Doug Ford, the Premier, was asked about construction sites yesterday, the safety of them, if enough is being done to keep people working in those sites safe and healthy. Take a listen to part of his response.
Message to every construction worker in this province: you don't feel safe, you don't feel that you have the proper equipment, or the company's not keeping you safe, leave the site. Leave the site and don't come back.
And not just with the construction sites, Heather, the Premier, the government has been saying for businesses that are staying open, that are on that list, make sure you're keeping your employees safe and healthy. And for those that have to close down, the province is reminding businesses that they can continue to operate essentially online or having their staff at home, saying telework is allowed, online commerce is allowed for all businesses at all time. And one thing to listen for tomorrow, Ontario's Finance Minister will be making some announcements related to support for businesses affected by the pandemic. It was supposed to be budget day in Ontario tomorrow, Heather, but instead they'll be providing an economic update, and likely in that we'll have some relief for businesses.
Sounds good, Megan. Thank you very much. Megan Fitzpatrick in Toronto.
So we open up our store from 8 a.m. to 10 a.m. every morning, just for seniors only. The less people that congregate in one big area, the less chances are that the virus is going to be able to, spread itself around.
What you need to do to reduce your risk while you're grocery shopping is pretty simple. On your way into the store, remember to wash or sanitize your hands. You might want to think about sanitizing your cart too. When you're shopping, don't touch the produce unless you're buying it, and never touch your face. Remember, try to keep your distance from other shoppers and staff. 1 meter or 2 is best. As far as where you shop, it doesn't really matter, but if you can, you might consider using delivery or order online and then just pick them up. As for who should be shopping, let's state the obvious first. If you're not feeling well, you shouldn't be here. Same thing if you're elderly or you have a compromised immune system. And if you are healthy enough to shop, maybe think about picking up a few things for those that you know that can't. As for when you should shop, where possible, aim to avoid peak hours so you can avoid the crowds. Why people are buying so much toilet paper is due to something called panic buying, and it's why there's empty shelves in some places. Now, you definitely don't need to buy all the TP, but you might think about stocking up on any over-the-counter or prescription meds you might need. On top of food, it's a good idea to have enough cleansers and other supplies to last a couple weeks. Remember, keep your trips to the grocery store to an absolute minimum. And when you do get home, you might want to give your fruit and veg an extra good scrub. And on your way out, you got it, wash or sanitize your hands again. Aaron Collins, CBC News.